Dr. Anthony Fauci is the director of the National Institute of Allergy and Infectious Diseases. He's also a member of President Trump's coronavirus task force. Good morning to you, Dr. Fauci. It's very good to see you. We've just done a piece where
Good morning, Gail. Good to be with you.
I'm so glad you're here. Listen, we all know the cases are climbing, things are getting out of control, and people are very afraid. Why is this happening again right now? You predicted it, though, earlier.
You know, so unfortunately I did, Gail. There are a number of factors that are feeding into this. You know, our baseline of infections all along has never gone down to a level that would allow you to be easily controllable when you get cases that soar up for a variety of reasons. Right now, as we are in the cool season of the fall and soon to enter the cold season of the winter, that makes it very problematic because people out of necessity will be congregating indoors more than outdoors. This is a particular issue as we're approaching the holiday season of Thanksgiving.
I've heard you say the cavalry is coming, but it doesn't mean you put down your weapons and that people are letting their guards down.
That is absolutely correct.
People are letting their guards down.
You know, it's understandable. I don't want to be critical of that, but we want to just plead with them to understand the dynamics of this outbreak. If you do that, we'll continue to soar. If we do the things that are simple public health measures, that soaring will level and start to come down. You add that to the help of a vaccine, we can turn this around. It is not futile.
Dr. Jha just told us, David Begnaud, that the testing that we need in this country is far below what it needs to be. Do you agree with that? And what does that mean exactly?
Yeah. Well, I think what Dr. Jha was saying is what many of us have been saying, is that there is community spread right now, which means there are people in society who are infecting others. They don't have symptoms. They don't know they're infected. The only way you can get at them is if you only test people who are symptomatic. You are going to miss the asymptomatic people who are silently spreading the outbreak. So we need to pour more testing into the community to get a feel and identify who in the community is spreading the infection, because it isn't only a symptomatic person.
I want to talk to you briefly about Thanksgiving. I'm changing my plans after listening to you. You're saying you're not even going to spend Thanksgiving with your lovely daughters. You're keeping your Thanksgiving celebration very small. If you're with a small group of people, do you need to wear a mask indoors? Somebody told me that even if you're in your house, you have to wear a mask. Is that true?
You know, yes, it is true. Now, obviously, it's kind of difficult to be eating and drinking at a dinner with a mask on. You can't do that. But to the extent that you can keep that mask on, I mean, nothing is going to be perfect in this. But if you're indoors and gathering with people, even if it's a relatively small group, to the extent possible, keep the mask on, even if you are indoors. Now, obviously, the smaller the group, the less the risk.
Even if we've all tested negative, Dr. Fauci?
Well, that's a different thing. I mean, then the risk goes way down, and then you make a risk assessment. You know, we always talk about things. Nothing is risk-free. But when you do a risk-benefit ratio, and you say to yourself, now, wait a minute, I just got tested. My husband or wife just got tested. Our children are coming in. They just got tested. Of course, it's not 100% that they could have gotten infected from the time they got tested to the time they got there. But when you get that degree of minimization of risk, then you really use some common sense and say, you know, I'm willing to take that very, very small risk so I don't have to be walking around the house with a mask. People who say wearing a mask indoors, they're really talking about when you get into a setting where you're really unsure what the status of people are. But when families go the extra mile of either quarantining or getting tested, then I don't think you really have to say every moment you're in the house you have to have a risk. You've got to use some common sense and make sure you look at what relative risks are, because the relative risk is going to go way down if everyone's been tested or people have been quarantined. So it's just really common sense in that regard.
And before you go, I want to know how you're doing. Listen, you get death threats, you work 24/7. You know, there are issues with the White House. I'm wondering how you're holding up to all of this. I know it's your job, I get it, but I want to know how you're holding up physically and mentally.
Well, thank you for asking. I'm actually doing fine, and the reason I'm doing fine is twofold. I've taught myself over the years to focus like a laser on what my goal is and what I need to do, and to me that's a big thing. It's the health, the safety, and the welfare of the American people. That driving force makes all that other stuff that you're talking about become peripheral noise that I don't pay attention to. And the other thing, I have a spectacular wife who is amazingly supportive of me and has been now for the last 36 or plus years. So I'm doing fine, but thank you for asking.
All right. We thank you, Dr. Fauci. Thank you for taking the time today.
Thank you.